welcome. Thank you so much for joining us today. My name is Lindsay Cox, and I'm the Senior Manager for Advocacy and Outreach at HFA. Today, we're going to be giving a brief Copay Accumulators update. We'll get started with a brief discussion as to what Copay Accumulator Adjustors are. Copay Accumulator Adjustor programs, or CAAPs, are a cost containment tactic where insurers limit the extent to which patients can benefit from manufacturer copay assistance programs. The insurer accepts the manufacturer assistance, but then doesn't credit any assistance towards patients' deductibles or out-of-pocket limits annually. And it really draws down the value of the assistance. Many consider it double dipping. The insurance companies are double dipping. Once that assistance is depleted, the patient is presented with a bill for the copay and coinsurance associated with their next prescription fill. Patients end up on the hook for out-of-pocket costs up to the full amount of their out-of-pocket maximums. Now, Copay Accumulator Adjustors, of course, present this continuing affordability and access issue for patients who rely on the copay assistance programs to help afford their medications. If it's not counting for them, then that means they have to pay more, and that's exactly what the copay assistance programs are there for. Now, this is the newest cost containment tool that insurers are applying, and they're applying to all different types of health plans, which is impacting more than 90 million subscribers. Plans refuse to allow the value of cost-sharing assistance from third parties from being applied to a subscriber's annual deductible or out-of-pocket limit. Most often, it's applied to manufacturer assistance, which include copay coupons. But in some cases, it also involves nonprofit charitable assistance. And you'll notice if you do run into a copay accumulator adjuster that we're seeing frequently abrupt increase in out-of-pocket costs, and often without notice for patients. Does my plan apply accumulators? Well, that's a great question, and it's kind of tricky to answer. Accumulator language is often very hard to find, even for experts. Information is buried within hundreds of pages of documents, which makes it very difficult to try to find. And frequently, they don't just have one name. They're disguised with confusing names like out-of-pocket protection programs or specialty copay solutions. Now, those sound pretty good, but unfortunately, those all are describing copay accumulator adjuster programs. Plans say accumulators may be applied sometimes, and then they can be sprung on consumers with little notice. So sometimes a plan say, oh, it might happen, and it might not for a while be implemented, and then all of a sudden they could be implementing a copay accumulator on your plan. And I think I like this cartoon on the right. I think everybody can relate to this a little bit. I'm sorry, but stress is caused by trying to figure out your health insurance is not covered by it. I think we can all relate to that a little bit. So talking about legislation, what can we do? Obviously, copay accumulators are a big deal for our community and can have severe negative impacts. So what is happening? What are we doing to move the needle on positive change for the community? So we have good news for you. There's been a lot of activity over the past couple of years in terms of states putting out bills and passing bills regarding banning copay accumulator adjuster programs. So in green, you can see the 12 states and Puerto Rico that have passed laws within the past 3 years banning copay accumulator adjuster programs. So 7 of those, more than half, happened in 2021 this year, which is very exciting. So there's been a huge push and a big movement on the needle of 12 states, which is great, have made these and passed these bills to protect patients. Now, in yellow, you can see all of the states that have had activity. Now, many of these states have come very, very close to passing legislation, but couldn't quite get over the needle or still had some kinks to work out. So we're hoping that seeing so much activity, that's a positive sign, and that we can continue to push in those states to really try to get these passed to protect patients and protect the bleeding disorder community members that live in those states. So a little bit of a map visual to help understand where the laws were enacted and where there's been activity, but hopefully at some point a law enacted soon. So talking to legislators about accumulators, you might want to get involved. I know certainly when I heard about this first, I wanted to get deeply involved in this. Talking to legislators about accumulators. Copay accumulators and Copay accumulator adjuster programs can be sort of hard to understand when you're speaking about them at first, because it doesn't really make much sense. You know, logically, insurance companies are double dipping to a degree. So talking about it in regards to yourself and really taking a step back and explaining things once or twice can really help. So copay assistance is a lifeline for those with bleeding disorders, and it's really important to stress how high cost bleeding disorders treatment can be and how important these copay assistance programs can be to families. It's a lifeline to those who cannot otherwise access high cost treatment to prevent permanent injury or death. Copay accumulators can abruptly disrupt treatment without notice with very few coverage alternatives. Accumulators are counterproductive as they decrease the consumer adherence to treatment and lead to worse and more costly health outcomes. And just like we were saying before, insurers are double dipping by keeping the cost sharing assistance from the third party, while also again collecting the full cost sharing obligation from the consumers. Copay assistance does not drive consumers with bleeding disorders to more costly treatments because we know in our community there's no generic alternative. So even within, more specifically within our community, CAAPs do not make sense because there's no generic alternative. So what's happening on the federal level? You might say, this is great. I'm so glad that we're making progress in certain states in the United States, but what if we could have a federal piece of legislation passed so that it would really cover all states in the United States? Well, that's a great point, and that's exactly what HFA and several other national organizations are working on now. The Help Insure Lower Copays or Lower Patient Copays Act, or the Help Copays Act, which is HR 5801, was just introduced recently, and it seeks to rein in harmful health plan pricing schemes such as copay accumulator adjusters, and protect vulnerable patients from soaring out-of-pocket costs. So what's wonderful about this bill is it's a bipartisan bill to prohibit caps in large employer and self-funded plans, which is where most Americans get their health insurance, as well as an individual coverage. So insurers could no longer exclude the value of manufacturer cost-sharing assistance from counting towards the consumer cost-sharing obligations. Plans must count all cost-sharing assistance for covered services. So it's basically telling the insurers, hey, listen, if you're receiving a payment on behalf of a patient, you must accept that towards their cost-sharing obligations. So this legislation was introduced on Tuesday, November 2nd, 2021, so fairly recently. And like I mentioned before, it has bipartisan support, which is very significant. So it originally had 1 sponsor and 8 co-sponsors, and we've added an additional 6 co-sponsors since introduction, which is great. HFA recently had our fly-in, and we met with 40 different offices talking to them about this particular bill, and we had a plethora of folks sign on afterwards, which is great. And we've been in coordination with many other offices since then, hoping to get additional co-sponsors. As you can see, we're currently and still seeking additional co-sponsors to strengthen the piece of legislation. So how can you get involved? Have you or your family ever experienced an accumulator? If so, please share your story with us at HFA. You can go to projectcalls.org and share your story there. Not only can we have somebody reach out to help you navigate that copay accumulator adjuster program, but using these stories in advocacy when talking to these legislators are incredibly impactful and really show the real world value of copay assistance and why it's so important to our community. If you haven't faced an accumulator, but you use copay assistance and you think it should be protected, you can go to the link on the right, which is right down here. It's p2a.co/S 2GJCH8. And that will bring you to an easy to use online tool that allows you to send a message to your lawmaker. It's very, very easy. As you can see, I took a screenshot here and you can take a look. You just have to put in your name, your address, your phone number, and your email. And we have already taken the liberty of writing up the body of the email that will be sent to your lawmakers. Now you can go in and you can change it if you'd like, or add some personal story or some personal touches. But all you'd have to do after that is click send email, and it's just that easy. And you can show your support for the piece of legislation and hope to try to make this bill get passed and help others in the bleeding disorder community who might be facing accumulators regularly. You can also follow advocacy alerts from your local member organization and from us, HFA. You can sign up to participate on our website. You can get email blasts from Word from Washington and our Washington Wire every month. And you can keep updated with this, or if we have additional actions that we would love for our advocates to take, you'll be on that list and you'll get that information. You can also sign up to participate in your local advocacy days. As we mentioned, there's been a lot of activity in so many of the states in the United States. Many of our bleeding disorder community member organizations have been focusing on accumulator adjuster bills in their own states. So you can ask your member organization if they are doing that, and if not, to see if they can get something going in that state. So sign up to participate in local advocacy days, because more likely than not, one of the topics will likely be Copay accumulator adjuster programs. And that's it. If you have any questions, by all means, feel free to reach out to me at I'm Lindsay Cox, the Senior Manager, Advocacy and Outreach at HFA. You can reach me at l.cox@hemophiliafed.org. My cell phone number's there, our office number's there. And if you have specific questions for the public affairs team, you can reach out to us at advocacy@hemophiliafed.org. Thank you so much for taking the time to listen today, and we really hope you do participate in signing and sending that email to your legislator, because we know what a big difference it makes. And that's one of the reasons why we were able to get so many co-sponsors on. So thank you so much, and we really appreciate it.